Clive, in his Western Australian model and the South Australian Dental Service, share a passion that the competency of the people doing this work for people in residential aged care is adequate to the task, and that I'm looking forward to the evaluation showing either way.
I have had some experience. I work for an oral and maxillofacial surgeon, so basically when we see patients, it's often the tooth is in the bucket, it's the end of the line, and we actually visited for a number of years nursing homes taking out teeth, and one of the things that a lot of the assistants in nursing that we were dealing with and aged care workers would tell us that they simply didn't have time, and to look in the mouth. They were busy checking feet and all that sort of thing. I guess my concern is that are the people you're looking at, your RNs, your aged care workers that you want to do these assessments, is it just another expanded duty that they don't have time to do? And again, question that the funding is going to train people in another area that they're not trained in when you've specifically got people that are already trained that could expand those duties.
We're not looking at people doing more than what they'd be asked to do on a normal day, really, because that is part of their job. So what we're trying to do is actually provide them with the skills and the knowledge so that they can do that quickly and efficiently, because part of the thing that they have to do on a daily basis is maintain oral care, and that is to assist people to either clean their own teeth or to assist people who can't clean their own teeth. So the oral hygiene part is really for the workers to be able to do what they actually have to do now, and what we hope to do and what's been proven by the SA Dental Service project is that by giving them some more information and skilling them more, it's making them more efficient. So it's actually giving them more time to do the other things that they do. Another project that we have is on nutrition. So the links between those two projects are very important. And I think that, this isn't about trying to give them more to do. This is trying to give them what they already do in a more efficient way. And that's very important. So we're not looking to train people to do things that are outside their scope.
One of the comments that are said to me by nurse managers who I'm constantly dealing with on a daily basis, they go, oh my God, they've got something else for me to do. Aren't I busy enough? They've dedicated me as the team leader. Why aren't we going to give me someone who's really good so that then they can hand me I'm saying, as I explained to my dental students, because being a lecturer at UWA, this is the time when this oral examination that you're doing is going to be your most challenging. This is going to be the hardest exam you do. This is when you dot the I's, cross the T's really well. Why are we handing this on to a nurse? Or this is the hard one. This is where the dentist comes in. This is where a dentist should be on the ACAT team so that we do it well. It's you guys that really just can handle the assessments. These people deserve the really good stuff.
Okay.
So as you say, we're weighing them up. You can definitely see I'm along the lines of supporting the nurse manager and saying, hey, you need a secretary. You need good people like dentists who go in and hand you the real information, give you a real care plan. Because I think in South Australia, almost a high 90% referral for people who have conditions which we're seeing, which with oral disease, that's very high.
It's not a question, it's a comment. A few years ago, I had an RN who was doing final year dentistry, and he chose as his dental research project looking at two groups of people to motivate them, and these were I don't think they're enrolled nurses, the nursing aides in nursing home facility that he was actually working in to put his way through university. And he looked at their motivation for doing oral care. Now, he recognised the fact that this was a task they did, but they weren't doing it well, and he wanted to stimulate them to do it better. And he split it into two groups on the basis of two different teams that were working. He did a training on one team on the basis of oral health care and how improving their oral health improved their overall health and all the rest of it. He then had a bit of lateral thinking, and he looked at the other group and decided that one of the reasons that they were both groups in fact, but one of the reasons they were not doing it is that they perceived oral health disease as being a long-term disease, and the people that he was treating didn't have a long-term lifespan, and it was an unpleasant procedure for both them and the carer. But what they did do was spend an inordinate amount of time doing people's hair, shaving them, putting makeup on the ladies, and doing all of these things which they enjoyed. So the second group, he trained in halitosis prevention and worked on the basis that if Granny had halitosis, nobody liked to give her a kiss, and this was a nice thing for people to do. And at the end of the year when he did this project, the people who were cleaning the teeth much better were those that were doing it from a hygiene perspective and the halitosis prevention rather than those doing it in healthcare. So I think at times we get over-focused on our own ideas that health care and prevention is so important, when in fact some other people down the track who are doing that work can approach it from a different angle.
My name's Karen Sleishman, and I was involved in the South Australian Dental Service project, and it's just an observation from the home that I was involved in at the Cara Nursing Home in Newcastle. And initially when we undertook the training, we did have a lot of resistance from the care staff that they perceived they didn't have the time, perceived it to be too difficult. But from the training, we gave them an understanding of the importance and the benefits, the short-term benefits that they can have to their residents. And they did, with sort of, not really wanting to undertake it, but they did, they performed the duties, and they started to see results. They started to see the benefits for the residents, and they saw them very quickly, and some of them were quite significant, and it was those results that then fostered this, they took the project on board then. They saw the benefits and they were doing it very well. And as it was said in the state, only 3 residents, the initial assessments were undertaken in the August of 2008, and we performed the dental treatment over the December-January 08 and 09. The final assessments were undertaken in August of this year, and only 3. So there's a long time between the initial assessment and the staff maintaining that level of oral care. So it worked.
I'm sitting here resisting the urge to defend aged care, and so Karen, I thank you to show that something actually was sustainable. I think one of the observations that both you and Lynn have made is that is actually about the training and the quality of the training, and everybody I think understands the best principles around training. But one of the things that we found when we discussed with our staff what their understanding about best practice in this area was that there was no training that wasn't tired, that wasn't the same thing they'd heard every year and they didn't learn anything, or was actually presented differently. So that told us the story about what we needed to prepare for our staff in terms of their training experience, but also told us what it is that was sitting out there. So I think that these new skills or these new tools, and particularly the relationship with the aged care channel, will actually have a very positive outcome for the training for people. So I thank those involved.